on this episode of A Tale of Two Hygienists.
A lot of people think the boards of dentistry are like, oh my God, if I have to go in front of the board of dentistry, I don't know what I'm going to do. I'm going to be so scared. They're mean, they're this, everything. They are not. I got to tell you, they really want to see that you did make a mistake, honestly. It wasn't maliciously. It happens. People make mistakes. They wanted to see that you understood it and corrected it. So what have you done since then to actually correct it? And are you taking ownership of it? We have to take ownership when we make mistakes, because we do make mistakes. Just being part of something bigger than yourself is what's important. Being part of a group of like minds that really believe that change needs to happen. And it can be at whatever level you want it to be. You don't have to do what I do. I would never ask you to do any more than you're willing to do, but I'll only ask you to think about it and be there. Come to the table at some point.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 481. I'm your host, Andrew Johnston, and thank you so much for joining us today. On this episode, we meet up with Kathy Cabanzon. We talk a lot about kind of what she's doing and what she has done for us at the state level to make meaningful change, because I think that that's been a hot topic lately of, how can we get involved? How can we make things better for us? And so we talk about the role of the Board of Dentistry, specifically in Florida, where she was at, what power they have to make and enforce rules, how they can be involved in making the changes that improve the dental health of those living within their state's borders. Kathy is also doing some amazing things with this alliance, the Florida Dental Hygiene Alliance. Not only are they doing advocacy work, but I just on their website that they're offering some free courses. I think the one for the site today was on myofunctional therapy, and it looked like a really great course. They also have other resources for education, for advocacy, and things like that if you want to know how to get involved. I think the bigger thing here, though, is Kathy is open to collaboration, helping anyone who wants to be involved in their state. If you just don't know how to get started, make sure you reach out to her, because she is a wonderful resource. Also, if you want to know more about the courses and things that they're offering with the Alliance, you can head over to their website, fldha.com. I also have that linked in the show notes if you want to just directly click on that. I think that's it for this intro. Thanks for listening, and enjoy this episode with Kathy Cabanzon.
A tale of two hygienists.
Listeners, welcome into the interview portion of the podcast, joined today by Kathy Cabanzon. Thank you so much for being with us today.
Andrew, thank you so much for inviting me. This is extremely exciting for us.
What's exciting for me is, and this probably is going to make you feel a little bit uncomfortable, and I'm really sorry if it does, but I've known your name for, I think, the day 2 that I moved to Florida. Everyone's like, if you want to know something, ask Catherine. And then I'm like, okay, well, I'll eventually get to it. And I was looking up at, what was I looking up? I think I was looking up like the dental board to get licensed or something like that. And they had like all the past officers and stuff. And I'm like, oh wait, Catherine was on the Florida Dental Board as well. And I'm like, that can't be. Is that true? Were you on the Florida State Dental Board?
Absolutely. 9.5 years. I was the only hygienist to ever chair the Florida Board of Dentistry.
Dang. Wow.
Yeah.
Can we start? I'm sure you have a lot more you want to say. Can we start the journey into this discussion with that aspect? What I try and explain to people, everyone's talking about the ADHA and the power of the ADHA and things like this, but I really think that the dental boards, especially at the state level, are very powerful entities. Do you mind talking a little bit about kind of the roles, responsibilities, kind of what those meetings look like, the things that you guys discussed and were trying to get past or not get past? What was that experience like for you?
It was the most amazing experience. I don't know why, but I always loved laws and rules when I graduated in 2001. It was instilled in me that you do the right thing, you're ethical, and all is good after that. You take good care of your patients. So I really did learn them well, pass my laws and rules exam. And I just was always interested in it. And I was also interested in it because it was where a place of change could happen. In our state, our board is not allowed to legislate. The legislators legislate, but our board can develop rules to support the legislation that is changed. And, depending on how broad that law is, it gives flexibility for board members. So I was on a task force for the Surgeon General, Florida Surgeon General, back in maybe 2008. And it was to a workforce task force in the state of Florida, looking at access to care issues and things like that. I ended up having a breakout session with vice chair of the Florida Board of Dentistry, the president of the Florida Dental Association, and myself, who was part of a public health initiative in a think tank in Florida. So I said, okay, here I am with the big guys, and so one of them had asked me. He said, "Well, what do you guys want in Florida? What do you people want?" And I said, "Are you referencing dental hygienists?" And he said, "Yes." And I said, "Well, it's not really what dental hygienists want. It's what do the people need." And somebody had asked me, he said, "But, I'm here wearing a different hat. I'm here as my board of dentistry hat, protecting the public." So I said to him, I said, "Can you answer me a question then?" And he said, "Of course." And I said, "Who's protecting the people that get nothing?" And he said, "Wow." He goes, "I never thought of it that way." So he and I became friendly. A lot of good things came out of that task force. We did pass our health access law. And that gentleman, that dentist, he had reached out to me and said, "Would you like to be on the Florida Board of Dentistry? Would you ever consider it?" And I'm like, "Yeah." I never say no. I'm like, "Yeah, sounds fun. Let's do it." So I had to put the application in and all that. And I did get accepted to it. So first few days going in, you are like, what on earth is this all about? Because you are there in almost it felt like a courtroom kind of style. You've got, people coming in for licensure issues. They're coming in with complaints. And in the first few times that you're in there, you get an orientation, but it really is a huge learning curve, a huge learning curve. I was very lucky that a lot of the board members were amazing at what they did, and they taught me a lot. Board attorney was incredible, incredible, and I learned a lot from that. So the processes are basically if somebody files a complaint, it has to be investigated through the investigative department of the board, through the Department of Health, Florida Department of Health. If there's probable cause, it gets brought to a probable cause panel. Back in the day, hygienists were not allowed to be on probable cause panel. I did have that rule changed. So they are allowed to be on. At the time, it was only for hygiene or dental assisting issues. And now one of the board members now has a change. They can be on dental issues as well. So that was a great experience as well. And then a settlement agreement kind of comes up with the Department of Health and the probable cause panel, and then it gets sent back to the dentist, the doctor, whoever it would be, and their attorneys look at it, and then they do have to come in front of the Board of Dentistry, and go over the settlement. They can either accept the settlement or it opens up for other board members to discuss. Did they agree with what the probable cause came up with as far as a settlement, or do they want to discuss it? Do they want to reject the stipulation? What would it be? And that's pretty much the process. And the person who's on probable cause cannot be part of that. So, it's just a vote for the other members that were not on probable cause. And we can change it, we can add, we can take away. And there are guidelines in your laws, and I think everybody has them, of what you can impose as a violation, depending on if it's a first time, second time, or third time offense. It was amazing. And some of the other things that we did too was, the licensure part of it is usually done in the back door. But if there's part of the licensure application that says that maybe you did have an issue on a previous license, or you ever had a violation, like you're ever arrested or had a misdemeanor or anything, you would have to check that. And you do have to come in front of the Board of Dentistry for that. And you just plead your case. Now, I will say a lot of people think the boards of dentistry are like, "Oh my God, if I have to go in front of the Board of Dentistry, I don't know what I'm going to do. I'm going to be so scared. They're mean, they're this, everything." They are not. I got to tell you, they really want to see that you did make a mistake. Honestly, it wasn't maliciously. It happens. People make mistakes. They wanted to see that you understood it and corrected it. So what have you done since then to actually correct it? And are you taking ownership of it? And you think that's in anything in life. We have to take ownership when we make mistakes, because we do make mistakes, but learning from them and moving on. So the dentist who come in, or the dental hygienist, or any other dental professional that comes in, if they blame everyone but, usually the board goes, I don't see everyone but here. I only see you as the licensee here. So you have to take accountability for it. And that's usually what happens. It was very, very interesting cases, some really hard cases. There were some death cases that were really hard. Those were really hard. And so, it was an amazing, amazing experience. But I will tell you, after 9.5 years, I was okay to go. we, we can only do
Is that
10
the
years. We're capped out.
the 10 years? Oh, see, that seems like a long time though. Is that normal for board members in all, in states, or is this?
Each state is different. Here in Florida, you are appointed for a 4-year term. But what happens if there's a vacancy and that person who left didn't fulfill their 4 years, you fulfill that vacancy. So when I got on, it was April of 2012. And all of a sudden in October, I had to sign up again. So you have to re-enroll, reapply to it. And I'm like, so my term was only 6 months. And that's a learning curve. I said,
Sure.
So I fulfilled a vacancy of a hygienist who had left. And then I did
Gotcha.
4. So right there, it leaves you between, you would never be consistent in 4 if you fill vacancies. So,
Yeah.
yeah.
Man.
Yeah.
It's fascinating, I think, the rulemaking process. Can you talk a little bit about, okay, so Andrew lives in Tampa. He has a suggestion for, it doesn't really matter where it's at, whether it's access to care issues, whether it's scope of practice issues, whether it's whatever. What is the process for petitioning the board to help either make a ruling on it, or help encourage legislation change on their counterparts, or the rules change? What does that process look like?
Okay, so in our laws, it specifically states if anything has to do with dental hygiene, it has to go to what they call the Council on Dental Hygiene. That was put into place a few years before I was on the board. And I was the chair to the Council on Dental Hygiene. So what happens is, if one of the associations, or even you as Andrew Johnson, would want to have the board consider doing a rule change. Let's look at a supervision change, okay? Say we had, and this was a true story, scaling and root planing, antimicrobials were under indirect supervision, and we wanted to change that. Somebody wanted to change that to general supervision, okay? So what they do is they bring forward the request. That request has to be heard. And because we're sunshine law, everything discussed must be within that sunshine realm. So we cannot have conversations to each other on the side. So then that would go over to the Council on Dental Hygiene. The Council on Dental Hygiene would have to publicly announce that they've got a meeting, because it needs to have anybody who wants to be in attendance to it. So they have to post that and announce that. And then the council has a meeting. There are the chair is a dental hygienist on the board, active member, and one of the dentists on the board, and then 3 other dental hygienists from the community are on that council. And so we listened to it. Whoever brought it forward would talk about and discuss the reason and the rationale for wanting to bring that forward. And then we would either vote in favor or not in favor. It then must go to the full board for discussion and for a vote. So scaling and root planing was one that came to the full board. There was great rationale behind why to do it. It did pass the full board. And then when it passes the full board, there's a period that it's got to go through, like a joint appropriations committee, which is senators, and to make sure that we are within our rulemaking authority. Because just because we want to change something doesn't mean that the law has given us the authority to do that, the board. So and for any person who is not in support of that possible rule change, has the ability to do what they call a workshop, request a workshop and come in front of the board and discuss why they would not be in favor of having that rule change. So just because the board wants it doesn't mean that it'll happen, because again, during that workshop, board members may change their mind and then vote again, not in favor. So that's like a 21-day process. So this did happen. I had no clue that most of the dental organizations would not be happy having scaling and root planing and antimicrobials placed under general supervision, because I had been asked a gazillion times to do that, and I never did. Even looking at my schedule, if I had a perio maintenance patient, I was like, doctor's not here today. That's still part of perio. So I said I can't, and I was always real good about doing that. But then it gave a problem to my patients. Where do you put them in the schedule? I'm booked. So are we really doing a good thing for our patients? So the workshop started, and almost every single dental organization was against it and came up and spoke their piece and explained why they felt that we would not be capable of taking care of a patient if they weren't in the office. And fortunately for us, not unfortunately, but fortunately for the profession of hygiene in Florida, the board still agreed to pass the rule. So the rule ended up going through, and it became a rule. And that's how we changed it. So
That's incredible.
it is incredible. So, and
It's a long process, right?
it is a long process, yeah, because it's got to have that legal process and allow people to speak to it. You can't just, and that's what I did appreciate about the boards, is it's not just those 11 members. We have 11 members making those decisions. They open it up for others to say, hey, why? What's going on? I need to hear more. I need you to hear my side of it. And that's what I think in anything that develops change or advocates or regulates really should have that open forum of discussion between the professions or whoever else is involved. But fascinating,
And
exciting.
and it really is. Are there actually, let me switch tactics here. I was gonna start going down some more things I want to get changed in Florida, but we don't have time for that. Instead, I'd like to actually focus on this advocacy thing again, because you as of recording this morning, your article was published in the eVillage newsletter, and you talk a lot about this new alliance that you're creating. And I know that you've been passionate at all of the different levels, not just the board level. And we can talk about other ones if you want, of other service opportunities that you've had in your career. But you're really passionate about advocating for the profession, advocating for patients and everyone, citizens of Florida. Can you talk a little bit more about maybe your experiences outside of the board, and then kind of what you're doing with the alliance now?
Absolutely. So let me take you down memory lane to the reason why I became an advocate. I was a senior student in my dental hygiene program, and my aunt worked for the Area Agency on Aging. And what she did is she organized training sessions for the volunteers that would help with seniors in the community in my town, West Palm Beach, my county. So she says to me, "Oh, hey, Kath, is there any way you can come and do a screening, an oral cancer screening at my fair?" And I said, "No." I said, "I'm not allowed to look into a mouth unless a dentist tells me to." So she says to me, she goes, "That's absolutely ridiculous." She goes, "I've got people doing blood pressure. They're doing body mass indexes. They're doing all these things." And I thought about it. I go, "You know what? You're right. That is silly. What on earth? I'm trained. So only if a dentist tells me I can do it, then I can do it." So she kind of asking me that question and saying this ridiculous kind of led me down that path of, we need some change in this state. So prior to 2004, a dental hygienist was not allowed to do any screenings at any health fairs. We were only allowed to work, whether it be in a public health setting, as long under the supervision of a dentist. With that authorization, you may look in a mouth. So that was changed in 2004, and I was so excited because I was kind of like on the ground floor of that. Being from Palm Beach County, one of the senators who was in my area championed that. And I
Nice.
campaigned and knocked on doors. I was like, oh, I said, what is little Kathy Cabanzon going to do? But they remember that. It is the grassroots. Grassroots is everything. The legislators love the students. They love to hear from their constituents. You don't have to be Kathy Cabanzon that became at a state level or anything. You can be that person. That one person may make that change and difference because the legislators will hear you and something will click with them. So I saw how powerful that was, just that small grassroots. And of course, at the state level, they did their thing and stuff. So I got bitten by the bug of making change and knowing. I believe in our training. I believe in our standards of education. I believe in maintaining the standard of care, and we are taught to that standard. We are really good at what we do. We are the nurses of the mouth, I always say. And why are we only limited to being in a dental office? I just never understood that. There's so many people who need care. We need to be doing more. And that brought me into my public health, advocacy, seeing that stuff, seeing people who didn't have anything, and even the people that would come into the office who couldn't afford it because they didn't have insurance. That saddened me, and it should sadden every healthcare provider for anyone who can't get care, because that's really what we took an oath on. It wasn't about making an extra dollar here or there or whatever, and we all need to, of course, live in dental industries. It's a business too. I get that. So get that. But what happens to those people? What happens? And then the U.S. Surgeon General's report came out in the year 2000, the year I'm getting ready to go be a senior. And my husband, who wasn't diagnosed with perio, was my patient. He's got perio. He's got abscesses. He smokes. And he had heart disease. And I'm thinking, oh my gosh, my husband's going to die. So what do we do for all those people? Now, of course, we understand a lot more, and so do I. But as a student, it scared me. For what are these people that are getting nothing? Whether it be, I don't care what age you are. And so I delved into public health a lot and helped to make a lot of changes. And I really advocate for every single person in this state and in the rest of the nation to be able to get good health care. And why, if we are trained, if we are allowed to do it in an office and we're not killing anyone or hurting anyone, why is that our limit? So now we can do public health, and a lot of places do mobile dentistry. And in Florida, we can work unauthorized and unsupervised. And I will tell you, since we passed that law, there's no complaints, no discipline action ever, even with local anesthesia. Can't do in LA, Kathy. Oh no, you're not a dentist. And I'd be like, somebody had to teach you, so why can't somebody teach me? And since that happened in 2012, we passed that. There's not been any violations or complaints on a dental hygienist for local anesthesia.
I love it.
So that's where we're at. Yeah.
So it's like it was I caught fire in you, and you kept going.
Yes. I just said, we have to have a voice. And it could be a single voice, it could be a group voice. It just needs to be voices. And if you believe in this in your heart and you want change, and we hear those, if you don't speak up, then you can't complain, I mean, not everybody can, because some people are nervous about it and it makes them uncomfortable, but there are other things that they could do. Just being part of something bigger than yourself is what's important. Being part of a group of like minds that really believe that change needs to happen. And it can be at whatever level you want it to be. And I always said that. I said, you don't have to do what I do. I would never ask you to do any more than you're willing to do, but I'll only ask you to think about it and be there. Come to the table at some point and say that you want change. That's all I ever ask.
I think a lot of us are willing to support people. Like there are people that want to be the leaders, and maybe they don't even necessarily want to be, but they're very highly capable individuals and they can be leaders. And then there's people probably more like me, where I'm like, I don't want to be that person that's up in the spotlight and the thing, but I will support the crap out of you from, either afar or whatever that looks like. What are the issues or the challenges or the things that you are advocating for currently? Like what are you still looking? Is it still public health related, or have you kind of pivoted?
It is public health related. We, so our state Dental Hygiene Association has partnered with Floridians for Dental Access, which is a coalition of hundreds and hundreds of organizations and individuals such as myself, or even you, Andrew, who believe that there is an access to care issue, and volunteerism is not the answer. Volunteerism is a part of it. And we all know that solutions to any crisis is multi-pronged, right? Got to go in the toolbox. There's a lot of tools in the toolbox. We need a lot of tools. Florida has the challenge. We do have our sealant programs, our school-based programs. It's getting better. So our children actually have decreased in some of their issues, but it's still not enough. If we could do only prevention, awesome. But what about the people still need drill and fill? They do. They still need that. And they're going to the emergency departments. And they shouldn't be going to the emergency departments, because you and I both know they get an antibiotic or a pain pill. And go find a dentist. Well, they got there because they couldn't find a dentist. We are one of the lowest states for reimbursement, Medicaid. I get the reason why. I'm not going into why or whatever. It is what it is. So we don't have a lot of Medicaid providers here. So if we could have a provider like a dental therapist be able to give that care, We may be able to loosen it up a little bit for dentists, so dentists could do practice at their highest of their scope. And then the dental therapist would be able to provide the fillings and maybe go into the schools. Because a lot of times we can't even get the children, we get the people to the dental practice because they can't take off of work.
Right.
So if we can go to where they are. And then what about your intellectual and developmental disability population? Oh my gosh, they get nothing. And they have so many issues, so many. And our seniors, those are huge gaps for me. So yes, so we are supportive of dental therapy, working legislatively. We're very, very close with the Floridians for Dental Access, and we are trying to move that forward. The Alliance is part of that as well. We are working at putting together, because of my history and my knowledge base of stuff, I'm pretty good about looking at laws and being able to wordsmith a little bit and work with others who know that and develop, like I have this process of when somebody says, what does that mean? And this is our challenge. I'll be like, well, if the challenge is that a dentist has 8 hours, this is an example, 8 years of education, but a dental therapist only has 3, that's really not factual. The dentist has 4 years of dental school, maybe 4 years of a bachelor's. So really, they're only educated in 4 years. A dental therapist will be educated in 3 to do a quarter of what a dentist could do. You don't think they could learn that? It's just like the local anesthesia.
That senior year must be amazing in dental school if it's really that much, right?
They gotta learn how to do endos and surgeries and all that. So I like to be able to grab that misguided thought, which gives a perception for legislators, because legislators don't know about dental. They're not
Right.
in the dental world, so they don't know. And be able to break it down to, let's just look at it logically here. There will be prerequisites. There will be prerequisites for a dental therapist. There will be the 3-year CODA-approved program that they have to go through to learn a few of the basics. Fillings, grade 3 mobility teeth extraction. So when somebody says that's an irreversible surgical procedure, my response is, you can't reverse a grade 3. I'm sorry. So it is not it's going. So, it's funny because my granddaughter loves to extract her grade 3 mobilities. And she always comes to me, she goes, Grandma, can you do that? And I'm like, I can't, not licensed in the state to do that. I'm joking. And she doesn't know what that means, but she goes, okay, I'll do it. So my granddaughter pulls her. She does. I know that freaks me a little bit, but she will.
That's kind of funny, actually, though.
It
Well,
is funny
it's
when
that.
you think about
It's
it.
the whole
Well,
thing is like, yeah, we'll hypothetically, this may or may not have happened in my share a time or two. When a patient does come in with, flapping in the wind, like they exhale and it's like you can see it flutter, right?
mhm.
And they happen to have a piece of floss left on the tray, and I turn my back for a minute and I turn around, man, you know what? That tooth came out. And like that's, there happened to be maybe some topical or something around around the tooth tissues as well. And I'm like, oh, but you can do that, but I can't do that. And even though I'm trained in the mouth, and you're not at all as a patient trained in the mouth at all, that
Correct.
there is a discrepancy there for sure. So when you see these things that are happening, I don't even want to go as far as saying injustices, but they kind of are actually
It's that.
definitely an oversight at the
Mhm.
smallest of degrees. What is your, I don't want to say maybe predictions the right word? Like, what do you think is going to happen? Yeah, and how long do you think the process is going to take before us to really open up that ability to give better access to the people that need it?
It takes a lot, and it really takes the mindset of the legislators. It takes how well we're explaining the opposition's challenges that they have for wanting to pass it. Are we good at messaging? Are we good at grassroots getting on the ground floor? I think that's something that's lacking a lot, is that everybody thinks it happens in Tallahassee, from my state, Tallahassee. It's not.
Mhm.
It's what happens at home first. You've got to build those relationships with those legislators and teach them and educate them. Sometimes I'll have a lobbyist that's working for passing dental therapy. She's like, Kathy, can you explain to me what a pulpotomy is? And I'll be like, sure. She goes, remember dummy again? The legislators tell her dentistry. I go, okay, I got that. So I'll do it and I'll send it to her. And she's like, still don't know. Make it. I'm like, how less can I? So it's basically, it's when there's decay, it's soft and mushy, and they can take out the mushy, soft part, but they can't go into where the root canal is. And
Yeah.
you try, and she made me realize they don't. We think people know dentistry, even our patients don't get it. That's why communication is so important in every aspect of life. Communicating is everything, everything.
hmm hmm
So it's just going to take time.
If someone wanted to get involved, though, to kind of hurry that process along, how hard is it to find your local legislators or to get in contact with the senator? Because I think for a lot of us, I know that that stuff is posted online, but it still seems like a bridge too far. Like they're not really going to respond to us. They're not really going to listen to us.
And a lot of people do believe that. So what I believe is important for an association to do, regardless of what that association is or who that association is you have to educate your state, whether it be at the local level, whether it be at the state level. That is huge. Give them the tools. Like, so for the Alliance, for example, we're posting, how do you find your legislator? There's a link. You just go type in your address. I didn't know how to find my legislator. They were like, look at your voter's card. Well, I know what district I'm in. It doesn't, most of us don't even keep our voter's card anymore. So giving tools, we have to share tools. And again, most people might not want anything, but they can do an email. Do you know how great an email is? If a legislator heard 20, 30 emails from their constituent in that area saying, I've seen a patient, that patient had an abscess, they can't afford to do this. We need to help. We need to get to these people before they get abscesses. That's powerful. That's more powerful than me being in Tallahassee. It is much more powerful. And I learned that from this one senator when we passed the screening law. Knocking on a door for a senator and doing something grassroots and connecting with them at home is more powerful than giving them money. I didn't know that. It's
I
so
wouldn't have
powerful.
thought that either.
They need to hear from us, because think about it. If they're trying to work on issues in their counties for you, but they don't ever hear from you, how would they even know there is an issue? Yeah. We're the only ones, we're the educators. So it's just talking to them, being just down nice and easy, talking just like you and I are talking. It's just, this is what I've been seeing. This is the challenge. I hear there's a possible situation that could possibly increase or help it or do whatever, and just keep talking and don't give up. And don't think because you're the hygienist that scales teeth all day, they won't listen to you. Trust me, they will. They will. We had one student who met a legislator in Jacksonville, and they love the students. Legislators love the students because they are the future. And he had asked her, why not just go to dental school? She said, that's a really great question. She goes, I really like to focus more on prevention. That's why I'm a dental hygienist. And I don't want the burden of that. And I don't want the surgical procedures that they do. I really want to get people, even if it's just at an early filling stage, and teach them never to have one again. That's my goal. Where dentistry is more about restorative, isn't it?
Mm-hmm.
So it's a different mindset. And that legislator was thoroughly like, wow. It just like clicked with, which was huge. So one
I love
person,
that.
and it clicked. That's all it takes.
So if I'm one person and I'm listening to this podcast, and I happen to live in Florida specifically, how can I get involved with the Alliance? How can I, what is your call to action for us, the listeners?
Call to action is to reach out to your local legislators. There are specific legislators that will be on the committees where these bills hopefully will be heard, and educate them. You don't have to ask them for anything. Just educate them. Educate them why you feel this would be appropriate. Educate them on the training. Educate them what a dental hygienist is too. I think that's really huge, because do people not perceive us as the people who clean teeth? I never say the word cleaning. I can't. It's hard for me unless I'm talking about cleaning my car. So it's they need to know that we don't clean. We do prevention and we do therapy. And if we're not telling them and teaching them that, so I say to everybody, even if we don't have an issue, meet your local legislator. They're just like you and me. Most of them have other jobs. Some of them work, they're lawyers, teachers, whatever. Some of them have other jobs. That's not their full-time career. and teach them who you are and what you are, and teach them the situation and problems that are going on in your county and in your area with experience stories that you've seen in here. We've all seen the stories or heard the stories with our patients, and just take it from there. Teach first. I always say to all hygienists, just teach. Why do people not understand what causes a cavity? Sugar doesn't cause a cavity. We eat more sugar than anyone I've ever met. The dental world eats a lot of sugar.
We do. If you look at our break room, that's very true.
Right? But when I first graduated, I was like, my God. But we know how to prevent it. We know what to do.
Yeah.
So teach what causes a cavity. Teach what causes these diseases. Teach that dental diseases need to be treated parallel to how medical diseases are treated. Teach. Teach your patients, teach your legislators, teach everybody. And then maybe we can make changes. But if they don't understand, change doesn't happen when people don't understand. And especially if there's opposition to it, that may be a little bit more powerful in their voice or in contributions, or it's hard. It is hard.
Yeah. Well, that's why we all need to be involved. I think, Carolyn, thank you so much for being on. If someone wanted to have maybe a little bit more insight, if they had questions for you specifically, questions about the Alliance, where can they go to find you or find an email address? Like, what can they do?
Okay, so the Alliance, it's called the Florida Dental Hygiene Alliance. We are on Facebook. We are on X. We are on Instagram. We are on LinkedIn. Our website is www.fldha.com. And you can get on there, see everything. We are young. We are 2 months in the making. But we have developed a organization. We are incorporated in Florida. We have members. We have followers. We are putting out some really good stuff, like changes in the laws, like how to navigate that. Not just celebrating hygienists. We are celebrating hygienists, but it's more about you, the information you need to make change, or what's going on. Do you want to make change? What are some issues you want? I really shy away from asking the question of what would you like to see, because the usual will come out, independent practice and all that. We need to get to where we can get, but is that really what we want? I think we can all work together. I really, truly believe that. Why can't we all work together? And there can be semi-independent, or they can be, and I don't even like that word independent because it leads to connotations. I believe we have to work together because we need the drill and the fill, and we need the restorative, and we need the prevention. We need it. Just like medicine. Medicine works together. So, just basically be part of something that's more than yourself. I worked in private practice, in a sole private practice with no hygienist except for myself in the very beginning. I felt very isolated. Being part of an association was huge for me. And it saddens me a lot that's going on. It saddens me how I was a diehard member of my national and my state organizations, volunteered hours and hours. My husband would be like, is this volunteer again? I go, yeah, it's volunteer again. But at the end, it's going to be good. It's going to be good. And then to see that some weren't as passionate as I was as a volunteer. And I said, where did that get lost? And then realizing, and you helped me a bit with this too, Andrew, listening to your podcast, was the states do all the work. And we do all the work. And I'm not saying our national organization hadn't helped. For years, they had helped some things. They had, because I've always been very, very involved in governmental issues in my state, and they had lent the help. But then it dwindled away, and it changed, and I didn't support some of the initiatives they had put forward. And I said, are you speaking for me? Because I don't feel like you're speaking for me anymore. So I felt that, and that was challenging for me. And then there was always how do I frame it? I wanted it to be more about, the association to be more about the hygienists themselves, not the leadership. I really did. I felt everybody had a voice, just like with the Board of Dentistry. It opened up and others could come in and talk about, well, why are you doing this? And I don't agree with that. And can you listen to my side? I don't think we had that. I really believe transparency is huge in every aspect of anything we do, if we do it for the whole or for the group, or we say we do. So that's where I made that decision. I said, national is having challenges and issues. I know a lot of people have been asking for change, but I haven't seen that turn yet. I wish they would, but I haven't seen that happen. States are having challenges too. And then that terrified me. I said, if our associations don't survive, there's nothing. There's no voice.
Yeah.
And who do we gather? How do we group? How do we get together? So I decided to start the Florida Dental Hygiene Alliance. I have 2 co-founders with me. I'm going to shout their names out if you don't mind.
Yeah, of course. Please do.
Sue Kassoff Korea and Alan Thomas Holmes. Like minds, very, very active as well, but they believed in developing this type of an alliance that can run parallel to our state association, but really will focus only in on Florida issues, even though we can look at national issues and support national issues. But if we're going to make change in Florida, we got to work for Florida to make that change.
Right.
So, so we did this, and in 2.5 months, my goodness, we're going for 501c3 status. Hopefully get that soon. We've started webinars. We're getting hopefully accepted for CEs very, very shortly. Application is pending. And it's for every single hygienist. It's not for just members. I believe that in my heart. If you don't want to be a member of your national, you have that right not to want to. But should there not be something for somebody who doesn't want that? We're missing a gap. We talk about gaps all the time. What happens to the people that are getting nothing? Because they can't afford that larger, or they don't believe in supporting a national, they want to support a state. Other organizations have where you can break off. You could support the national and the state, or you could support just the state. Why don't we have that? And why are there not more dollars coming to the state? The work that we are doing, we could do so much more. I believe we probably could pass a whole lot more if we had more dollars, because volunteerism is hard. It is hard. And I'm not saying that I ever want to be monetarily paid for because I believe it's a service to my profession. But you have flyers you have to make, you have lobbyists you have to pay for, you have other things you have to transport. If I go to Tallahassee, it's 9 hours from me. Gas. So it's a monetary expense to advocate sometimes too. So if our states had more dollars, they could do more things, or maybe even open up some screening programs or some more school programs for these children and for seniors. It's endless if the dollars go back into the community instead of going to a national association that, frankly, I haven't really heard much from them. Except
Yeah, I mean, the thing I like about you so much, though, is that you are creating a pathway for the everyday hygienist, right? And I still feel in my heart that we do just need some fixing at our national level. And I think once we fix it and we get the transparency you mentioned, the communication that you mentioned, the support that you mentioned, maybe flipping some things about the dollars is going to the states, all of those things I still feel are true. I really hope that we can find a way to do what you are doing and still work with the ADHA or national associations the way you're trying to. I love that you're running a parallel in tandem with, as opposed to being like antagonistic and all of that. And I think that, I know you were on a phone call with, another state group of people trying to do a very similar thing to what you're doing. And I know that, we talked about California before, and then people in Washington are doing it. This is happening all over the country. And I really hope, and maybe this isn't your message, but this is my message. I feel like I have to have some sort of stewardship over this, is that we need these small grassroots advocacy groups, alliances, whatever they end up being. At the same time, we do need a larger national presence to some degree. And I really hope that we can get this fixed, but it's going to take all of us, all of our voices, really trying to lobby to them to get their act under control. Catherine, I'm sure we could talk quite a bit more about this. I'm going to have you on probably several more times in the future. Thank you so much for everything that you do for the citizens of our state, and that's the great state of Florida, and also all the hygienists. Thank you so much for being on.
Well, I thank you for doing this, because without your podcast, people don't hear it. I could be saying it all day long, but how are they going to hear me? So you help to bring voices out. You help to connect. You help to make people start thinking, asking the questions themselves. You know what Andrew said? Yeah, just like when my aunt asked me that. Isn't that ridiculous? So you allow us to start going, yeah. And that's what people have to do. We have that right to do that, to think, not to be blindly led. We have a right to think, is this the right thing or isn't it the right thing? That's a choice. I thank you, Andrew.
Well, thank you. Thank you for your kind words. I appreciate that. All right. Have a good day.
You have a great day too. Bye. Thank you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.